Who is interpreting your examination for medical imaging? A radiologist or a non-physician? What happens when non-physician practitioners interpret medical images? Does the lack of qualified physicians in the United States mean a decrease in the diagnostic interpretation of medical images? Possibly so. Less doctors, less radiologists, the more we rely on ancillary staff. Worldwide, healthcare professionals other than radiologists who are trained and certified in radiologic clinical evaluation can also perform primary interpretation of medical images, and this depends on the scope of practice and the regulations in their country or region, including the United States. To become a radiologist or a diplomat of the American Board of Radiology, it usually takes at least 13 years. This includes 4-year undergraduate degree, 4-year medical degree, a 4-year residency in radiology, and a 1 or 2-year fellowship in a subspecialty. It's not common knowledge, but non-physician practitioners can read x-rays legally under certain conditions. These conditions may vary depending on the state law, the type of diagnostic tests, and the level of supervision required by Medicare. NPPs, or non-physician practitioners, in the United States must act within the scope of their practice as defined by state regulations. This means that they must legally be authorized to perform service under state law. The practice of non-physician practitioners, NPPs, such as nurse practitioners and physician's assistants reading and reporting diagnostic studies such as x-rays, ultrasounds, CT, MRI, and nuclear medicine study scans, differs from the responsibility of a radiography assistant. No, the RRA cannot interpret medical images. RRA stands for Registered Radiologist Assistant, which is a certified radiology technologist who has graduated from a formal radiology program. The RRA works under the supervision of a licensed radiologist. Here's an example of a study that was done over a 5-year period. Out of 3,348,881 imaging studies interpreted by NNPs during a 5-year period, 53% were for radiography or fluoroscopy, while 26.1% were for ultrasound interpretation. Only 12.8% was computed tomography and 5% for magnetic resonance imaging. And still, we have nuclear medicine imaging, which had only 2.7% interpretation. It is currently unclear from the Medicare claims data whether the services billed by MPs and PAs were performed independently or with some measure of oversight from a radiologist. Non-physician practitioner billing for imaging interpretation reportedly had over a 25% overall increase and a 30 to 40% increase in communities under the national median health income. These would be small rural communities and underserved communities. While in a metropolitan area, the increase was 30% from 2016 to 2020. This reflects 110,649,811 commercial and Medicare Advantage insurance claims. According to a study by the Harvey L. Neiman Health Policy Institute, they had found that diagnostic rates of imaging interpretation by non-physician providers are on the rise and account for 2.6 to 3.3% of all imaging studies interpreted. Although the highest overall rates of NPP interpretation of images were seen in rural and small town areas, the most significant growth in the rates of NPP interpreted imaging over the study period were seen in both metropolitan and micro-metropolitan areas. As some states are granting NPPs greater autonomy, are finding that the greatest growth in NPP imaging was among those states with less stringent scope of practice laws, and this matched our expectation. The Medicare physician fee schedule for services rendered by NPPS at 85% of what it pays physicians. Non-physician providers provide care at a lower cost, and if their concurrent and downstream service is the same as that of a physician, the CMS should not be billed the same. While acknowledging that the non-physician provider in the emergency department, for example, can increase patient access to care and at a lower Medicare reimbursement rate than physicians, a recent study suggested that the facilities also consider the cost of increased imaging use among non-physician providers. The scope of practice for a radiographer is different than the scope of practice for a physician assistant or any other type of healthcare professional. Scope of practice is simply a term that describes the activities and the procedures that a healthcare professional is allowed to perform according to their license, their education, their training, and their competency. A scope of practice is determined by laws and regulations that vary from state to state and from profession to profession. Non-physician providers are healthcare providers who have some degree of autonomy and can perform some tasks that are traditionally done by physicians. With the increasing number of radiology practices that employ nurse practitioners and physician's assistants, research reveals corresponding increases in Medicare claims for submission for evaluation and management services and also for diagnostic imaging services. These non-physician practitioners are becoming more involved in diagnostic imaging, especially in rural and underserved areas where there may be a shortage of radiologists. Citing related research, one survey of nurse practitioners found that 75% expressed no confidence or being somewhat confident in assessing even simple skeletal radiography. Some of the challenges and limitations of the non-physician practitioner in image interpretation may include the lack of formal training and certification in radiology, which may affect their ability to detect subtle or complex findings, recognize incidental findings, or provide appropriate differential diagnoses. There is a potential for increased liability in malpractice claims for non-physician providers and their supervising physicians if errors or misdiagnoses occur due to inadequate image interpretation skills. The possible duplication or fragmentation of care if the non-physician provider interprets images without consulting or communicating with a radiologist may lead to unnecessary or inappropriate follow-up imaging, interventions, or referrals. Another area of interest when using the non-physician provider is the potential loss of revenue for the radiology practices and the radiologist for imaging interpretation services that would otherwise be performed by the radiologist. There is no formal training for medical imaging interpretation by non-physician practitioners that is universally recognized or accredited. However, there are courses for continuing education units that are available to learn about imaging interpretation. Often these courses are short and expensive. The courses can range from online to 1 or 2 day seminar. Before attending, you should check your state regulations and with your attending physician supervisor. Let's take a look at a typical seminar that is for chest X-ray interpretation for RNs and APNs. There are many times that a chest X-ray is obtained to assist in management of patient care. This seminar will provide you with a solid introduction to the interpretation of chest x-rays, using case studies, images of medical and surgical x-rays, and group discussion. Note the topics discussed in this short seminar. As we are looking at the imaging modalities getting more complex, the amount of data that they put together gives us more information, and the images created need to be interpreted. Should this be done by a radiologist, artificial intelligence, or a non-physician? As healthcare evolves, we're going to have to answer this question. Thank you for your attention. Please look for my channel, Mark Struthers, on YouTube to see other presentations about medical imaging.